This week's Ask Dr. Dury is from a patient who says that his doctor is not sure whether he has smoldering myeloma or active myeloma, and he wants to know what to do. Well, I would say in 2018, this is a clear indication of a need to get a second expert opinion, which can be extremely helpful. A main reason for this is that the criteria for smoldering myeloma and multiple myeloma have been changing, and it's really not unreasonable that the local doctor who's dealing with many types of cancer might be a little bit confused about the new criteria. In particular, we have what are called myeloma defining events, and these are new criteria that are used to define a need to proceed with active treatment for multiple myeloma. And those criteria are a free light ratio of 100 or more, and so this is the ratio of the free light levels in the blood. If an MRI shows 2 or more lesions, if the bone marrow plasma cells are more than 60%, and or if the kidney function is deteriorating. And so some of those tests could be confusing for both the doctor and the patient. So for example, if the free light level is kind of borderline around 100, is that sufficient for active myeloma? If one of the MRI lesions is maybe a little bit questionable and it's not clear if it's maybe a new lesion or not, this can be confusing. And so it is very, very important to clarify those points and to be sure what's the best approach. These criteria are now being used in addition to the traditional CRAB criteria to diagnose myeloma. Obviously, up to now, we've used a calcium elevation, clear abnormality of kidney function, anemia, or obvious bone lesions to diagnose myeloma. And so as we moved to these earlier myeloma defining events, we need to be especially cautious. And so in the first instance, one should repeat the testing. So if there's a question about the free light, repeat it in 2 or 3 months. Make sure if it's going up or steady, double check the MRI. But as I say, a consultation could be particularly helpful in this situation. And so the bottom line is, it is so important to know if you have smoldering myeloma where observation alone could be helpful, or maybe access to a new protocol, versus myeloma where very different treatment would be recommended. It's so important to know about this that there is a need to check carefully. And so double check the test results. Don't start treatment unless there is a clear decision one way or another, and monitor closely until it's clear if a need for treatment is there or not. And so a very, very important and delicate situation, and one where 2 or 3 heads are definitely better than one to make that correct decision.